All right, here we go. Gosh, the funny thing is you come from the South Bay and then you come into this fog. I picked up John Chen from the airport from SFO. I hate SFO. There's a reason why I send a driver there because Shoma don't like driving. So we are at Seton Medical Center. It started years ago in a galaxy far, far away. I was with Medtronic. It was a great time at Medtronic. Medtronic was really good to me. Jay Wachowski, Scott Siskarik, I was on their team. They supported, I think it was spine care, right? Bothwaite, Slozar, Reynolds. Reynolds still assists with Dr. Abi's case. Dr. Goldthwait still assists with Dr. Abi's case. Gaurav Abi came here. Chris Akumu came here. Ray Ashatori was here. There was a lot of people here. And so this place is near and dear to me, kind of. I got my feet wet. So hold on for a second as I just take it all in. Let's have a little walk down memory lane. Wow. Shit, I've come a long way. So we have Tim Schultz. Hi, Tim. Say something. You're on camera.
Thank you so much for coming to Seton Medical Center.
Yeah. What is your job title here?
I'm Tim Schultz. I'm the Associate Chief Operating Officer for Seton Medical Center, which is 2 facilities. So we have the main facility in Daly City, which is 256 beds. And then we have a secondary facility, Seton Medical Center Coastside in Moss Beach, which is 121 beds and has its own standby emergency department as well.
So, Chief Operating Officer, you got a lot on your plate.
Feels like it.
Dude, you're tall enough. Tall enough. I wore my UFOs today. They're great. I'm massaging my feet as we go. Okay, so you have a lot on your plate. What do you think you can do here?
So I think there's a lot of opportunities at this hospital.
Yeah.
First off, a little bit about the history. The hospital was founded in 1965 by the Daughters of Charity. And over the years, Seton was a pioneer in a number of different areas. Seton pioneered the first angioplasties and over the years created a state-of-the-art cardiac care program, which includes cath lab, where a number of conditions, can be resolved, and then an open heart surgery program as well. Our second strongest line of business here is orthopedic surgery.
Yes.
So that's one of the lines of business we've been focused on with many of the orthopedic surgeons that Shomit just mentioned. We're looking to grow this line of business. We know there's a need in the community for orthopedic surgery and for strong cardiac programs. So those are really focuses of this hospital as we move forward. So we've done a lot of work to remodel the facility.
Seismic issues?
Yes.
So elevators work?
Elevators
work.
When HMC Healthcare first took over this hospital in August 2020, it had gone through a 2-year bankruptcy process under Verity Health. HMC acquired the hospital, and since then they've completed seismic retrofitting. So the entire hospital is seismic.
So we're not going to sink into the bay.
It's a strong hospital. It's a very, very strong hospital. We've remodeled the majority of the floors too, since we were going to close down many of these floors to do seismic retrofitting. We took the time to remodel the floors too. And now a lot of our focus is on Seton Medical Center Coastside. That facility was shuttered April 2024, and we've done significant repairs to that facility. As everyone remembers, we had atmospheric rivers the last 2 to 3 years.
Okay. Let me talk about non-weather related stuff. So let's get to the brass tacks of it all. We're here for orthopedics, spine. Let's make this place great again.
Yes.
Right? So you mentioned orthopedics. We had POA down below.
Mm-hmm.
What is Shabi Khan?
Shabi
Khan, great outfit. What? So what are we doing? Joints here?
Joints.
Sports med?
Some sports med.
Okay, some sports med. Now let's talk about what's relevant to me. Spine, baby.
Yes.
Spine day, all day, every day.
Yes.
Is how I feel.
Yes.
So what do you see foreseen? Because this was a booming. Look, you have the patients, right? You have the demographic. Where are they going to go? They have UCSF. Do you know what the wait time is for UCSF at the Air Spine Center? It's huge. Then you have what? Stanford.
Mm-hmm.
You have Sequoia, Common Spirit. You have some hospitals here. You have Sutter, Mills Peninsula. So I'm telling you, all your hospitals and their spine programs there. Why are people going to come back to Seton, Tim? That's what we're here to find out. And I got to tell you, I just picked up John Chen from the airport. Who is John Chen?
So John Chen is founder of HJY.
Yeah, PhD.
Right.
Sorry.
Many of the different vendors we've been looking at to bring unique and innovative solutions to Seton Medical Center.
Yes.
So we have a main operating room that has a lot of space for surgeons to do the procedures. So we don't have the long wait times that you described with many other.
There's 0 wait times, right?
Yeah, if you're coming in through our emergency department, you generally get seen right away. We have an excellent emergency medicine physician group that's been here for a number of months now. That's provided great service. You'll get admitted into the hospital, and then one of our orthopedic surgeons will work with you, see what's needed, and if there's a need to go to the operating room, we have beautiful operating room that can do the majority of procedures. Total joints, total hip fractures, spine.
How do we doing spine here? So Dr. Goldthwait would be.
Yes.
Yeah, Dr. Goldthwait is legendary, right? Like, he was one of the first ones to start really going after the SI joint. He does that procedure so proficiently. I used to monitor the cases when he used a Synthes screw, and he's been part of so many other evolutions of the SI screw, right?
Correct.
He is a genius, and even more of a very interesting man coming from Berkeley. Talk to that guy, and you will be wowed. So I love Dr. Goldthwait, but we need more. We need new people here, because Dr. Goldthwait is set. He's going to be moving on at some point. Maybe he'll still freaking be doing a little spine cases here into his 80s or 90s, but who's going to be the next crop of spine surgeons that come into this facility? That's on you, bro.
Yes.
Right?
Absolutely. So we
here comes some crew members.
We have a number of
Come on in, guys.
We have a number of new orthopedic surgeons that we've brought on board. Spine surgeons, we're still working on, right? We would love to be the premier procedure for spine surgeries as well. That's what we're working with Showman to see, what opportunities exist for the hospital to continue to innovate itself.
Well, I think you're doing a great step here, right? You're welcoming in new technology. So John Chen, PhD, I was talking to him in the car as I picked him up, and he's like, I'm like, you're the king of endoscopic spine. He's like, no, I'm just a king's aide. And I thought that was profound. I was like, this guy's done so much for the movement of endoscopic spine, 15 years doing it. I did some due diligence, He is friends with Michael Steck, who is a mentor to me. He ran as president for Eloquence, right? And so he helped basically grow and commercialize China from Taiwan, right? And so what does he do? He sees the pain points of a system like Eloquence. And right now, in my opinion, Eloquence is in shambles. They got acquired by this new Chinese company, right? The American dream of what Eloquence was when it first started is no more. I deal with their people. It has been horrible to deal with their people. For example, one of their VPs of sales on the West told Dr. Akumu, who is coming today, that he's not interested in doing endoscopic spine. And both Dr. Akumu, is Dr. Akumu coming today?
Yeah.
Dr. Chris Akumu, who worked here, who had an office here. Yeah. In Naragi's old, Fred Naragi, we still remember you. Dr. Naragi, you're a wonderful man. Yes. That was something. Hi. This is the COO. How are you?
Huh?
And, no, are we loud?
To come in?
No.
Want in?
I do not want in.
Oh.
Would you like to see the ambulatory surgical center?
I want to.
Dolly's been over.
Dolly, you don't know me? Dolly Chan, you were at Chinese hospital? No.
We're in a Chinese hospital.
But, we worked together.
We have?
I don't know. How long have you been here? Get this. Get Dolly. How long have we worked here?
43 years.
43.
Okay. I worked here for a long time, Medtronic. We worked together on the spine side. I worked with Dr. Abi.
No, I haven't done. I haven't really.
I know you haven't been in. You do the joints here in this little facility here.
we're gonna do the joints down here. Did joints upstairs.
Okay, but aren't you doing a lot in the surgery center? Why are you looking at me like you want to eat me up?
No, I'm just trying to figure out.
You want to give me a hug? You want to give me a hug?
I'm trying to remember who you were.
I was one of the best representatives here.
I thought you were good. I would have remembered you.
Yeah, but you weren't. Yeah, you weren't in spine.
Oh,
You weren't in spine. I hope you got that. I hope you got that. She was not in spine.
So
She was. Not,
So we're actually working on some
Yeah.
changes with the ambulatory surgical center. They just completed their CMS survey,
Mm.
and in the next couple of weeks, Dr. Christopher Viali,
We are.
his group will be taking over the ASC and privatizing it, so it'll be a surgeon-owned and operated ASC.
Here's
Very soon. So
Hey.
what's incredible about this ASC? It's one of the few that's
Oh.
connected to a hospital, right? So imagine you're bringing in your cases here, something doesn't go well, and you need to admit the patient. You're rolling them down the hall to the hospital.
You
And you're able to admit directly
anesthesia.
to the hospital.
That's
So
sick.
this-
You did that?
There was
Come
a team. There was a team that was involved.
Did
Dolly's been involved.
Hey, this is kind of cool, guys. I need Seton to survive.
Okay.
Don't you? I mean, you're almost retiring, so you're just like peace. But honestly, dude, I have relatives in this area. Where are they gonna go? Sequoia, Sutter, Mills, UCSF. Good luck.
Good luck. You see.
Yeah. Ooh, shots fired. But you're retiring. So this guy, he's tall. He's ready for the challenge. I think he's ready for the challenge. Let's get these halls with joint and endoscopic spine and outpatient procedures. Who is the gentleman that, do you guys have any stake in this, or it's 100% physician owned?
Majority is physician owned.
Majority is
Majority
physician
physician
owned. Okay. That is great, because physicians are, there some of them are good businessmen, right? And cost, but they also appreciate your team, because a good team, if you keep it absolutely, here's your joints team, here's your spine team. You have some great personnel here, and there's a lot of other people that would want to work at a hospital like this, because there's a lot of BS at like your common spirits. Yeah, I'm going to say it, at your common spirits at your larger entities, that you can get a fresher, cooler feel. What, SOAR coming back? Who's
Source still around?
SOAR is still around.
I'm still there.
Yeah, but they stopped for a little bit.
Yeah.
They stopped for a little bit during COVID. There was Apex Pain,
Mhm.
Dr. Fujinaka.
Mm-hmm.
I think he went on, right? Is he no longer in the area? He got married.
It's been a while.
But you remember it?
Yeah.
Yeah.
I don't-
Phil, did you deal with Phil? NGO? See, I know everyone.
Yeah.
Do I know everyone?
Sounds like it.
Yeah, I do.
So what's your part? What's your stake in all this?
I'm just here to observe. I have no skin in the game here. I'm here to drink my Celsius and meet this guy.
Oh, yeah.
That's it.
So
But-
24 days.
Can
I do.
Can we cut